this place, you are a human being and we'll do anything to keep you alive.
When you walk into the cancer center, everything just feels right, and I can't really explain that.
Living in this area, I tell people that if you have cancer, this is the place you need to come.
I've been to other places for treatment, and I would say that Del Camino was by far the best.
We are the team that fights the cancer. We are the team that has been assembled to do their very best against your disease. It is always with the patient in mind, with the idea that we want you to survive.
The thing that I'm most proud of in taking the program at our cancer center from nothing to where it is today is seeing, as we've reviewed statistics from the American College of Surgeons, that our patients, stage for stage, do better with respect to their prognosis.
Our survivorship rates are better than the top 25% of hospitals, particularly in the stage 3 and 4 patients who are very complicated to treat.
Once past our initial treatment, there is ongoing surveillance that we continue for years afterwards. Cancer affects their lives, and they need to have ongoing support and surveillance for monitoring their health and sometimes to deal with consequences of the treatment.
More than ever, this period of time where treatment ends and we move on, we know patients really struggle.
The cancer never hurt, never did anything, but the chemo has caused, wreaked havoc on me with side effects. I have severe neuropathy in my feet. My fingertips are numb. I stammer for words. I forget a lot of stuff.
We have 14 million cancer survivors living in the United States today. What we come to realize, though, is as these patients struggle to adapt to the new normal of their lives, it's important that we help them recover as much function as possible, both mentally and physically. There's a real fear sometimes that they're being abandoned, that they're on their own. And so I think the most important need is to educate them that they're not on their own, educate them that they are, however, the key member of their healthcare team.
Because there's such a strong need now in our community to have some form of a survivorship program, we've actually started putting together pieces. So the nutrition component, counseling after treatment, what to do next to decrease your risk, and then also having a social worker on hand. The other part of it that isn't as strong as where we're hoping to go with it is everything under one roof. So if we can bring yoga together, qigong together, art classes, art therapy together, journaling, laughter, music classes, support groups, all under one roof, then our patients will build more of a strong connection to knowing where their resources are.
To have all of that in one convenient place where it can all be centrally managed and coordinated is I think, very, very important.
Every cancer patient that I know has some ongoing issues, chemo-related or surgically related, that you're constantly working on for the rest of your life.
We started with a program that only had 700 new patients per year. We have a program now that has 2,000 new patients per year. That's a big program.
Philanthropic support has allowed us to go from nothing in terms of a cancer program to a cutting-edge, personalized, elite cancer treatment center.
We have used the money raised by donors to support all of the individual programs that patients would really benefit from. Our patient navigators, our high-risk breast clinic, high-risk melanoma clinic, and this year our survivorship program. We've really relied on philanthropy to bring us to the next level of cancer programs.
If more positive things come from the survivorship program, then everything will be great. I mean, cancer would not be so scary.
Cancer picked the wrong SOB to mess with. I have cancer, cancer does not have me.
People look at me and they say, they can't believe I have cancer, and because I look better and I feel better and I have more energy than people who don't have cancer. I'm Steve Kirsch, and I will survive cancer.
I'm Scott Michelsen, and I will survive cancer.
My name is Maria Piliero, and I will survive cancer.